Overnight, a massive logjam at Chicago's O'Hare Airport. Passengers arriving from Europe waiting several hours to undergo advanced COVID-19 screenings.
About 4 hours.
About 4 hours.
Standing in lines forever. Very crowded, which is not ideal considering what this contagion is.
Travelers packed together, creating mass gatherings, exactly what health officials do not want. Testing for everyone else is ramping up, but not nearly ready to meet the demand.
Are you here to get tested?
At this drive-through testing station in Colorado, enormous lines. In New Rochelle, New York, drivers screened before they could enter. Across the country, every state except West Virginia is reporting infections, almost 3,000 cases nationwide and at least 60 dead. Concerned hospitals are canceling elective surgeries.
There are now 64.
Georgia's governor has called out the National Guard, and the state is pushing its primary voting to mid-May. Overnight, officials in the city of Hoboken, New Jersey, announcing a nighttime curfew that will begin tomorrow. And a third NBA player has tested positive for coronavirus, Christian Wood from the Detroit Pistons. One person who's been cleared, President Trump.
People were asking, did I take the test?
Several hours after the president's Saturday news conference, his physician released a statement that his test for coronavirus is negative and that the president is symptom-free. The Trump administration now expanding its European travel ban to the United Kingdom and to Ireland after cases there quadrupled in one day. France ordered shut all non-essential businesses, including restaurants, cafes, even the Eiffel Tower. Spain has gone even further with a nationwide lockdown. And this morning, the Vatican has announced that it will hold Easter services without a congregation. Back in the U.S., North Carolina is the latest state to close its schools. Some 20 million kids in 18 states forced to stay home. That means a lot of high school musicals will never be seen by an audience.
Thank you so much. We love you.
That's why Broadway actress Laura Benanti invited young actors to tweet her videos of them performing.
So those budding stars are getting a new, albeit unusual platform, at least a small glimmer of hope in these really confusing times.
We will take it for now. Morgan, thanks so much. We'll see you again a bit later in the show. After dismissing the severity of the coronavirus crisis for weeks, the president now is trying to get his arms around it. And we are expecting new information later today about nationwide testing. NBC's Hans Nichols is at the White House with more. Hans, good morning.
That's right, Willie. Good morning to you. There's another briefing from the task force at the White House today, later today at 5 p.m., but no word on when the Senate will actually vote on that relief measure. But the president was definitive yesterday in the surprise press conference that it would pass. The vice president expects it to be bipartisan, like in the House. It's got paid sick leave and free testing among the provisions. And the president claimed credit for the Friday afternoon stock rally during his emergency declaration. But almost everyone at yesterday's briefing was clear. We are in the early stages of this crisis. The Surgeon General was explicit that this will get worse before it gets better. From a financial perspective, Treasury Secretary Mnuchin said that negotiations with Pelosi on more economic stimulus are ongoing. We're only in the second inning of this, in his words. More stimulus will be needed. Now, among the medical challenges, getting more tests out the door and to those drive-through locations, Vice President Pence has been promising, as you mentioned, they'll have more details today at 5 p.m. on both the new drive-through test sites and a new website designed to streamline the testing process, including a questionnaire. Mr. Pence has said that he hasn't been tested yet, but his office is establishing new protocols for anyone who comes in close proximity to the president or the vice president, and that includes testing everyone's temperature. Happened to reporters yesterday inside and outside the briefing room, and Willie, one reporter was turned away. Willie?
All right, Hans Nichols at the White House. Hans, thank you very much. Let's bring in NBC News science contributor Joseph Fair. He's a virologist who has worked on pandemics around the world. Good morning. Good to see you.
Good morning.
So you've been a good barometer. We've talked a lot over the last week or so about sort of where we are in this crisis. As we wake up on Sunday morning, where are we?
Well, as you heard, over 3,000 cases. We know that this virus can infect 2 to 3 people per confirmed case. So if you extrapolate that we have 3 times 3,000 or 4 times 3,000, even 2 times 3,000. That's going to take us from being number 8 to around number 2 to number 4 in the list of countries of how many cases we have ourselves.
We've talked a lot about social distancing in the last couple of weeks, which I think some people have taken seriously, others not. Bars and restaurants here in New York, cities across the country still packed. We saw France last night take the extraordinary step of closing its cafes and restaurants. Italy and Spain on complete lockdown. Is the United States headed toward that, where the country just says, we're closed for business?
To be perfectly honest, and this is not meant to invoke panic, but I think we are headed towards that state because, frankly, as you said, half the people aren't taking it seriously, half of the people are panicking, and there's a middle ground. We need to be in that middle ground, and we hope that everyone would take it seriously, but as you can see, that's just not happening. So France and Italy and Spain have all had to take those somewhat draconian measures to get people to take it seriously.
I mean, I'm thinking St. Patrick's Day is 2 days from right now. The bars obviously are usually packed. Should bars be closed before St. Patrick's Day?
Ideally, yes. You know, I wouldn't recommend this in any other time, and I wouldn't recommend it lightly. Personally, I love St. Patrick's Day, and I love to be in a bar on St. Patrick's Day. But at the same time, this is not the time for that. We've got to keep that social distancing and keep those measures in place.
Another term we've heard in the last couple of weeks is flattening the curve, which is to say keep this spike down of number of cases. But we can't even begin to know how many cases there are until there's widespread testing. What's the progress report on that? Will we soon have enough tests, as Dr. Anthony Fauci has indicated, that in the next couple of weeks, we hope the people who need to get a test can get one readily?
I think we heard 3 to 4 weeks ago that we'd have a million tests in a week, and then we've heard it again, and it's been revised again and again and again. I think we're finally on the path to getting that testing in place, but without it, we really don't know where to guide our interventions. So the only way we can flatten that curve is by identifying who's positive, who's negative, who's the most critical to get into care, who should self-isolate and take care of themselves at home. Because, you know, the overwhelming message, and still is, that 80% are going to be fine. They're going to experience mild to moderate cold symptoms. And just like you would handle any other cold, you can handle that usually by yourself at home. But that 15 to 20% in the high-risk categories, which, by the way, we lead the world in those high-risk categories, we're going to need to isolate them and get them into care as soon as possible to save lives.
All right, Joseph Fair, I know we'll be talking to you a lot more in the coming days and weeks. Thanks for coming in this morning. We appreciate it. Chuck Todd is NBC's political director and moderator of Meet the Press. Chuck, good morning. An extraordinary week. We expected to be talking about a presidential debate. We'll do that a little bit later. But let's talk about the White House and federal government's response. Of course, the president had said days and weeks ago that this would just go away, to everybody to remain calm. Let's not worry about it. He thought it was a Democratic and a media hoax that was being covered so much. He snapped to attention this week with an Oval Office address. What changed his posture toward coronavirus?
I just think the facts on the ground have had to change his posture. I think the fact that he has seen, frankly, the governors take the lead on this, because I think the federal government feels as if it's been a step behind or a week too late on some of these pronouncements. And clearly the testing issue, I think, really has cost the federal government some credibility points, perhaps not just with the public, but with some of their state and local partners. But, you know, Willie, we have a new NBC Wall Street Journal poll coming out today, and the president has had an impact on how seriously people are taking this. It is amazing the partisan split that we see. Democrats are more likely to abide by the rules of social distancing, canceling travel, than Republicans are by some 20 or 30 points. Wow. So it is fascinating to see that the president's sort of laissez-faire approach to this early on has had an impact on how the public is responding.
And even his own statements about whether or not he would be tested. We know he came into contact last weekend at Mar-a-Lago with Brazilians who later tested positive for coronavirus, yet he's still at that event on Friday shaking hands with people. Ultimately said he was tested and that it came back negative. What kind of message can the president and the federal government project that it's not projecting right now?
Well, I think that's it. I mean, you know, it does feel as if there's not a unified message out there of how seriously this needs to be taken. You were talking to Dr. Fair about the issue of bars and restaurants. There's clearly a concern that the guidelines that the federal government is offering are basically being consumed as, all right, things that you should try to do if it's not too much of an inconvenience. So they're definitely, I think, with the lack of the federal government sort of all hands on deck, you know, imagine what a previous president would be doing when it comes to getting celebrities to help out, famous people to help out. I noticed the governor of Louisiana has Coach O doing a PSA to say, follow the protocol, do this. This is, I think, a problem with the federal government response right now.
Let me ask you quickly before you go, Chuck. This was supposed to be a big debate in Arizona tonight with an audience between Bernie Sanders and Joe Biden. That's been moved to Washington in a studio with no audience. These big rallies have been canceled, one by the president included. Primaries being postponed across the country. What does the future of this nominating process and this entire election look like?
It's about as clear as the future of the NBA season.
Yeah.
I think the fact is it's in suspended animation. I don't know how Bernie Sanders can effectively go after Joe Biden tonight in a debate. In a normal circumstance, that's what he'd have to do, being in the position he's in. I don't know how he does that. I don't think the Democratic primary electorate, you look at our poll, they're much more concerned about coronavirus right now than anything else. So I don't know if you can accomplish much as a candidate right now anyway. So I think the best way to describe the campaign is in suspended animation.
Like the rest of the country, as you say. Chuck, thanks so much. Important show this morning for you on Meet the Press. Chuck will be joined by a man who's become a familiar face of the federal response to coronavirus, Dr. Anthony Fauci.